Hey, everybody. I am so excited that you are here for our Healing from Mold Exposure Masterclass today. I am here with Dr. Kasey. I'm so excited she's here. She's going to share a lot about her story and her and my journey going through this. Mold is obviously something that affects a lot of people. It's a very difficult thing to recover from. And also, you're going to hear me talk a lot about Lyme when I'm talking about it as well, because it's very similar in the process of healing. So, again, I'm so excited you guys are here. As we go through the presentation, I'm going to put up a couple times an offer for you to meet with me. So if you know this is something you need to address, you can schedule that right away. If not, feel free to schedule as we go through the event tonight if you are compelled to do so, and we'd love to meet with you. I only have 7 spots available in my calendar next week. So it is limited in space, but it is a free 45-minute visit. We just have you fill out an application form before you do that, just so I have information to go over with you before the call. And I'll give you some other direction in regards to testing or things to do to prep for that call as we go through. So let's get right on into it. And what are we going to cover today? We're going to talk about symptoms, short-term versus long-term exposure. The thing about mold is there's lots of different symptoms that can come up with it. It's very confusing sometimes to diagnose. So we're going to talk about proper testing, so you know exactly what to do with that testing, and then also path and healing to recovery. We're going to go through that process from beginning to end, what to look for testing, what to do in your home, what to do for your body. So those are all very important pieces when you look at total healing and recovery from this. Otherwise, you might get a little bit of it cleared up, but then it comes back because unless you get rid of it fully, you're going to be in trouble long term. So that's going to be the goal. The other thing I just want to point out is one of the biggest things I see as a practitioner, and Dr. Kasey and I talked about this, is when you meet with a doctor, maybe it's a Lyme specialist or a mold specialist, if that practitioner is a medical doctor, that is not good or bad necessarily. But if they think like a medical doctor or an allopathic model where they are going just to go for killing the mold or trying to manage your symptoms, you're going to fall short from a long term recovery. It's either going to cost you more money, it's going to cost you more pain, it's going to cost you more frustration in the process. So, one of the things you want to do when you're picking a practitioner, whether it's us or somebody else, what you want to do is make sure they are laying a good ground foundational point for you to have long-term success that isn't just going right after the symptoms or trying to manage the issues. You want to have a long-term success model. For example, why did you get mold in the first place? There's people that are exposed to mold that don't get it. Your immune system was already weak, so you need to address that. If your body and your gut isn't functioning properly and you go to try to kill these things and then you expose that, you're going to have a lot of symptoms. You're going to be really frustrated in that process. So that is one of the biggest things as we go through this is I want you to think when you're picking a practitioner, what are you looking for and why are we looking for those things so that we get the best long-term success. So I'm going to have Dr. Kasey share her symptoms in a minute, but just some things that I want you to start thinking about. And it goes from kind of like uh, most recent exposure to most chronic exposure for this is it can start with things like sneezing, coughing, wheezing, any sort of respiratory symptom. You can have things like just fatigue. If you're always feeling tired, your body's trying to manage these these processes inside your body. It takes a lot of energy, so you don't have the resources to be able to deal with the other types of things like your family and just everything else in general. Headaches, these can be chronic or once in a while. The medical studies say from the Neurological Society is that the proper number of headaches we should have within a year is 3 or less that resolve within 20 to 30 minutes. So I just want you to think about that. And one of the things Dr. Kasey and I talked about before we met also today when we were prepping is if you are struggling with some of these things and you don't think it's a mold or a Lyme issue, you're still a candidate to schedule a call. We'll just obviously address it in a different way because, again, more than three headaches is something telling you your body's not working properly. Muscle and joint pain, things like infertility, which is something that a lot of females that contact me are struggling with, which could be from lots of different reasons, but certainly one thing that mold can lead to. Because again, if your body is dealing with these things, it doesn't have the resources to maintain a pregnancy. And your body is very smart and it's going to utilize the resources to protect you first. Just like we're taught on the planes, right? Put on your mask first. Your body actually does those things and it protects you to be able to do these things. Ability to manage stress. So if you feel like, oh my goodness, when I'm at home or I'm dealing with work issues, I can't manage that stress as well. And I'm getting to the place where I'm kind of breaking faster. That can be a good indication of adrenal fatigue. So that's something that can be looked at. Memory loss or brain fog. If you're forgetting words or you're forgetting names or you're missing activities or you're forgetting your schedule or those types of things, these are things that your brain will actually take the resources necessary to remember these things to try to heal from the mold, and that can be one of the things that you have. Food and chemical sensitivity. So one of the biggest things I see with clients with this one is if you're in the grocery store and you go down like the cleaning aisles, if it's really like smelly and you're not responding to it well, that's a good indication again that this has been going on for a long time. Your toxic level is high and your liver is telling you, hey, get away from these things. It's going to create that sensitivity so that you are further and further from these toxicities. And then obviously blindness. This is like the when this progresses so much, this is how serious these things can become, is blindness. And I had a friend that went through, well, his wife was going through mold, and it was interesting because he and the kids didn't have any symptoms, but the wife had horrible symptoms, all of these times 10, and their dogs actually went blind in the process. So their dogs responded to it, but they didn't. So until they figured it out and started to work through this, they weren't able to address that. So I'm going to put up the offer now. If any of these resonate with you, make sure you schedule a call. And I'm going to have Dr. Kasey share kind of her
Sure. So
story.
just to piggyback on what Dr. Dennis is saying too. So I was the one who only had symptoms. Nobody else in my family had any symptoms. So mold can mess with you mentally too, because you can go, why? What is wrong with me? Is something wrong with me? So there actually is about 25% of the population that has a genetic mutation that actually makes you more susceptible for mold. So that being said, my symptoms, I had several of these symptoms too. I had headaches, I had super horrible fatigue, like so tired all the time. I had food sensitivities. I was probably at my worst down to 7 or 8 foods that I could tolerate without reacting to. But the symptom that was the worst for me was sinus. So I had chronic sinus infections. The regular doctors just kept pumping me full of more antibiotics and more antibiotics and more antibiotics, which actually makes the mold worse. It allows the fungi to just proliferate. So I didn't have any of the brain loss or brain fog or anything like that. Mine was all sinus, and I actually had mold colonize in my sinuses. So that was the majority of my symptoms. I even at one point had both sides of my nose close off and I couldn't get any air through my sinuses. So that was pretty panicky for me. But yeah, so mine were chemical sensitivities, food sensitivities, sinus, and just intense fatigue. And like I said, nobody else in my family, I have 3 boys and my husband, and nobody else had any symptoms. So it just was so challenging for me to try and figure out. They call mold the hidden illness, right? Because it underlies a lot of these things. So just as Dr. Dennis said, if you're having some of these things, it behooves you to kind of dig a little deeper.
And that damage you had actually resulted in you requiring surgery later, right? To deal with these
Absolutely.
issues. So
Yes.
again, it's not like just once it's clear that there's a lot of work to do. I always like equate it for anybody that's a patient of mine on here knows, like I always look at it like renovating a house. So one, you need to stop the damage. There's something creating damage. And two, you need to heal what is there. Both of those things are necessary. Otherwise, you don't have a good long-term
Correct.
approach. And I'm so glad you didn't have blindness
Yes. Me too.
or your dogs have
Right.
blindness. But I mean, these are serious things, and it just lets you know the effect and how dangerous these
Correct.
molds can be. So, all right, thanks for sharing that. Let's go to the next one. So I want you to get a pen and paper. If you are not familiar with survivingmold.com, I want you to go to this resource when we are done or when you're watching this webinar at any time. And I want you just to go through the resources. You can spend 10 to 20 hours going through it. There's so much content on there. And again, this is why like it can be really overwhelming when you start to do this. So it's good to have a practitioner that thinks properly, but this is a place where you can start going and getting some of that initial information and start arming yourself with the information you need, because it's the information that's going to help you to heal. One thing I learned from the patients I work with is nobody cares more about you than yourself when you or somebody you love is going through it. You'll start to research, you'll start to study. I would actually bet you that Dr. Kasey knows a ton of information that I don't even know, just because of all the research she's done when she was going through this. So I'm an expert in knowing how to test it and how to move it, but nobody is ever going to know as much about these things as when you are going through it. So one of the things you'll see on the website, which I think is the most important, just as an initial step, is to go through the visual contrast sensitivity test. Now, this test is just a visual test. It costs $15, so it's very inexpensive. If you have multiple people in your family, you can buy multiple tests. There's discounts for if you buy more, or if you know, like, hey, I know I'm going to be positive. I want to be able to retest later. These are options. But this has a 92% accuracy rate for confirming mold exposure, and it's sensitive to the point of 24 to 36 hours after contact. So if you've had contact with that within a day, you should be able to test how your body is being affected by it. Or if you know you've had chronic exposure, also the test is going to be sensitive to that. I'll let Dr. Kasey share a little bit about that she wasn't positive to this test, but was still having issues. So you want to share just
Yeah,
a
sure. So I
moment on
actually
that?
passed this test, which was very surprising to me to learn, later on I did have mold. But yeah, so I was that 8% that that didn't, test positive. So what I think that told me was, and to tell you all that, listen to your body. So you may have tests like I had when I first started my journey, all my blood tests were normal, right? All my other things that, the regular physicians were doing were normal. And I'm like, something is wrong. And so, listen to your body. If you think something is wrong, find the right practitioner who can help you.
Yeah, and again, 92% is a great accuracy, but there's still that other 8%. So
Correct.
if you do know something's wrong, again, maybe it's not mold, maybe it's something else, but maybe it is mold. So you want to use this again for, you know, most of the tests when you look at holistic testing isn't covered by insurance, unfortunately, because they're so in detail and they're so much more than what you're going to get from a typical medical practitioner. But most tests, when you look at them, one, take more time to do it. Sometimes you have to go to a phlebotomist to get a draw,
Mhm.
and usually they're like $200 to $400 to do the test. So for $15 to have 92% accuracy, this is the test to start with, especially if you feel like these are the issues going on. So um, definitely get this test if you feel like you are struggling with something, and you can order that right on survivingmold.com. What I want to go through with you now is kind of the testing process and what we went through. And then I'll have Dr. Kasey share kind of her process, because she's worked with multiple practitioners to work through this, and kind of why, this test is so important to her, all of these tests in this process, because I think it would have saved you a lot of time, energy, and money. Right, Doc?
Correct.
So, one of the things that we do in our office is a food allergy test. And the reason this test is so important is because if you are exposed to mold, your immune system is going to be weakened. And one of the things that your body responds to that you do more than anything on a regular basis, most likely, is eating food. So if you can start to identify one, what those foods are and remove them, you're removing a stressor that is currently there that's inhibiting your body from being able to heal at its full potential. Also, when I see patients that are very sick, chronic mold or chronic other infections, usually they will have a lot of sensitivities more than other patients because now their body is so stressed, their immune system is so heightened that more and more of these foods become issues. So you need to even be more strict with your diet till you get to a healing place. So then these things start to change and we start to see like, okay, now we can introduce in more of these foods and whatnot. But sometimes to start, it can become very strict on what those foods are. And
I'm
really
just
it's to
gonna add
support
one
your
thing
healing.
for Dr. Dennis. So one
Sure.
thing that told me, like when I was very in the throes of being sick, the one symptom that we actually didn't cover that was pretty big for me was if I walked into a building or I ate a food or I walked down the laundry softener aisle, I would get intense ringing in my ears.
Mm.
And that told me somewhere around you something is off and you need to remove yourself very quickly from that situation. So, ringing in the ears, a buzzing in the ears, if you're getting that often, that can definitely be a sign of some sort of mold exposure or some sort of mold. You've encountered mold somewhere.
Yeah, and that's a great point because there's so many other symptoms that we didn't go over. Like there's a list of like 100, but to
Yes, there's
go
so
through the
many.
PowerPoint slides, like, it would have been overwhelming to enter them and to read
Yes.
them, so I tried to pick, like, some of the most
Yeah.
common, but, yeah, if you're
But
having a
that's a
symptom.
strange one. I mean, but then, as I did my research and my reading, I did find that that's kind of something that if you are super sensitive to mold, you can walk into a building or eat a food and you immediately have this weird buzzing, sort of vertigo kind of sensation. So pay attention to that too.
Yeah, and that one's actually pretty common. Another one just that, triggered my mind when you were saying this is motion sickness.
Yes.
For patients that have a lot of sensitivities or toxic load that's increased, they'll have trouble with, motion sickness as well. So one of the first things we do is we're going to measure those foods and we're going to start working on removing those so that your gut can heal, right? Because if we are going to try to clear these toxins out, we want to make sure that as they're clearing, they're not going back into your bloodstream. This is why lots of patients have like what they call herx symptoms, or they're feeling worse as they're getting better. They feel like they're doing the right things. Their symptoms increase. So this is part of the process when I say laying the foundational healing. So we want to make sure we're healing the gut. So the first thing to do that is do some gut healing protocols, but then make sure we're removing the food. So we're taking the stress off the immune system as well and not creating more damage. The other one we look at is a stool test. So we usually spend about the first 2 to 4 months working on healing the gut and not only removing those foods in the healing process, but if you see the screen now, these are infections that patients have had that have went through mold or have been struggling with other health issues. So this test will actually tell us, are there any infections inside your digestive tract? What do we need to do to clear them? This lab will actually tell us exactly what to do to kill them. It will look at things like, how are you absorbing your foods? Are you getting your nutrients? You could be spending lots of money on very, very expensive supplements, and your body's not even absorbing them. You're just pooping them out. So we want to make sure that we get those things in place. We're not wasting time, energy, and money and frustration, so that the gut is primed so that then when we go into the detox process, your body can actually clear these things and get them out.
Right.
So,
Let me piggyback on you there again, Dr. Dennis,
sure,
because I think one of the
please.
things that's a key for Dr. Dennis's program is he keeps saying the word foundational, right? And so when and I keep going back to when I started my journey, I didn't know anything. And, I went to some practitioners who also were not mold literate. And so their first step in trying to heal me was to kill. Let's just kill everything, right? My body absolutely was not at a place where it could handle killing. And so what happened is I actually got worse in the process of trying to kill than it would to go through a program like Dr. Dennis's, where he gets what I would call my sort of connotation of it is sort of rebalancing your body and healing your body from a foundational level. And therefore, your body is able to handle the mold and maybe eradicate it on its own, but also be able to handle the kill process instead of starting with the kill process and sending you into these Herx reactions and all these other things that now looking back, of course, I know, but had I known that in the beginning, I would have sought this sort of process out first.
Yeah, I love that. And something else when you're looking for a practitioner, the other thing that you really want to watch for is that it's a practitioner that really cares about you, that
Hmm.
really is listening and is really trying to get you to the end result, because it's very difficult to find a practitioner that's going to listen, and they may know the protocols, but they're not experiencing the process with you. They haven't had results. So, like, lots of times when I was going through it with Dr. Kasey, she would be like, "Hey doc, I messed up. What do I do?" And I would always like just lovingly tell her, like, that's not okay. But what is the plan? Because at the end of the day, this is more about you and getting to the end than it is about me bringing you through a process or trying to get you a result. Which, again, if you look at the medical model, I will tell you there are cancer studies that patients have went through the cancer study, that at the end of the cancer study, the patients die, but the cancer was gone, and they will actually call that a success. Okay. So many times when you
Yeah.
reach out to me, and I want you to understand this, like, you're going to be scared. Like, this is like overwhelming what we're talking about. Um, and maybe you've put some resources in, time, energy, and money. I'm going to be listening to you, and we're going to make a plan that gives you hope and support. And I'm not going to waste your time, energy, and money. I appreciate those things. I am a small business owner. Um, I want to make sure that you are doing very well for you and your family. So make sure you have that practitioner that's actually listening and helping you to get those results.
And that's so key to everybody that's listening is that, there's a lot of practitioners out there, even holistic ones will say, oh, you have mold. Here's a cookie cutter protocol, right? Try this. Dr. Dennis listens and says, okay, every individual is going to be different. So we're going to take what we see with your individual data, your individual symptoms, and we're going to craft a program specifically for you, not just, oh, because you're this, this, and this, here's the generic protocol, because it doesn't work because everybody responds a little bit differently and everybody's got a different set of their own stuff. And I love that Dr. Dennis listened to me in the very beginning and I'm like, okay, I can do this, but I've got this. What about this? He was very genuine and very caring to say, okay, we're going to treat specifically what you need per se, not what a general mold patient needs.
Yeah, definitely in the office, it's not about me, it's about you, right? And that's why Dr. Casey is here, right? Because she knows that. And, that's why I want her on here to be able to share her truth and her results. So thanks for saying that, doc.
Yep.
So next thing is then we look at hormones. Once we go through detox and we make sure that the gut is healing properly, we work to clear out those detox pathways. One of the things that is really important is the liver plays a big role in how your hormones function. So one of the things that we talked about with symptoms is your adrenal glands can become affected. This can affect your thyroid, your adrenals, cause weight gain. So we can actually measure. So if you look at this daily free cortisol pattern here in the lower left corner, you'll actually see this patient, their energy is so low that their adrenal glands are tanked. So they're not having enough energy resources now to be able to deal with the day-to-day things. And this is what causes tiredness, fatigue, memory issues. So we can actually measure these things and then help to get them elevated. So this body is now again healing properly and it's functioning well and it's not retaining weight and dealing with a lot of these other symptoms. Um, and again, the reason we go in this process, we want to heal the gut first. We want to make sure as we're clearing those toxins, they're getting out. Your body's absorbing what it needs. We're getting those toxins out through the liver detox. Hormone support is now available in the liver. And now we measure those hormones. If I do this test at the beginning, of course, your hormones are going to be tanked. What we want to do is we want to get rid of all the factors that are causing issues first and then get a baseline and then build it up so that we can track it over time, because this is what is going to show us long-term success over time. So That's really important. And the other test that we look at is a mycotox test. And what this test does is it actually looks at how high your toxins are with certain molds. So I'm going to let Dr. Kasey talk a little bit on like her experience with this, but this test will actually prove to you exactly what those toxins are. And again, for me, I don't care as much what those toxins are as much as I care about having a process to get rid of them and how to
Right.
approach that. So I'm going to share the offer again for anybody else that wants to get scheduled. And Doc, why don't you share kind of your
Sure,
experience with the
absolutely.
testing?
So when I first started this process, my ochratoxin was 853. So I was 42 times the toxic load, which was just stunning. So I had ochratoxin and I had mycophenolic acid. And so I spent a lot of time in the killing process, right? And then 5 months later, we tested. My ochratoxin had come down to like 110, but 7 other molds had come up. And so I had a little mini like, oh my gosh, am I still being exposed? But what actually was happening was a healing process. So as I was getting rid of some of the ochratoxin, I did have some other layers of mold in there. And my practitioner didn't tell me that to begin with. And so when I saw the test, I was like, but it actually was a healing process that some of that other stuff was coming out. But again, this is where the practitioner you choose is so important. It would have been nice for that practitioner to say to me, oh, yeah, this is normal. Don't lose it. Right. But that didn't happen. So your choice of practitioners is very important.
Yeah, it's really important when you go through it. And Dr. Casey probably wouldn't say this if I didn't ask her, but some of her other practitioners charge at least twice as much as me, right?
And maybe 3 times.
Yeah, okay. Dr. Casey actually told me once that I should raise my fees.
I
And
did.
I try to keep them as low as possible to help patients. But something that's really hard is when you are finding a practitioner, most of the work that is being done is behind the scenes. It's not on the calls. When I look at one of these labs, I'm actually looking at every biological process, physiology, your symptoms, your history. So I'm mapping all of that out. So we just get on a call and I say, here are the steps. So most of that is done behind the scenes. So if you're not having, again, a practitioner that's looking for those things and developing that and putting in the time, um, it's going to
And
be
I'm
very
going to jump
difficult
on
to get
piggyback on you again
long-term
because,
success.
as I said, my first practitioner was a kill practitioner, right? And I think of thousands of dollars of supplements that I probably was not absorbing and literally pooping out, like Dr. Dennis said. And I'm like thinking, if I would have done the correct of course, hindsight is always 2020, but if you would have chosen the right practitioner and the right process to begin with, it wasn't just paying someone, it was then flushing all these supplements down the toilet that were thousands and thousands of dollars.
And
So again,
go ahead.
reiterate how important your choice of practitioner and process is to help heal you the right way.
Yeah, and think of that practitioner. I mean, something that's important to say too, like on their defense is they were probably doing nothing wrong when it came to diagnosing and killing and coming up with the steps and all of those things. It's just the body wasn't quite ready for it. It's almost
Right.
like if I painted a wall before I patched it and sanded it. Like I could have all of the perfect paint, but it's not going to come out right in the end even if I'm doing everything else right. So it's not that they were doing anything wrong other than the process. So it
Correct.
comes down to the process.
And
So
like I said, I clearly was healing because that mold was coming out, but boy, oh
yes,
boy, it was a deleterious to my body in the process. So yes, his strategy wasn't wrong per se. It just wasn't super great on my body as we were going forward.
right. So really when we look at the path to healing and recovery, and we'll close with this, is the key is you have to identify the exposure. Where is it coming in and you need to remove it. Even if you're healing from it and you're still in that environment, then your body is going to continue to come back. So you need to work on removing it. Um, I have a good friend, Chris, who works at Green Home Solutions up here. He has done my home. He can come to your house. You can look to see if you have a Green Home Solutions practitioner near you. If not, look for or reach out to me and we can talk about a strategy to find another a remediation expert, but you want to be working with somebody that is going to give you the resources to clear up the environment you're in. This is really important. One of the other things that I find so much with my mold patients is if you go on vacation, you'll usually feel fantastic within a day or two, maybe faster. And then you get back to the environment and you're having an issue. That's another sign that
Yes,
we need to fix the environment you're
100%.
in. You want to look at like cleaning air ducts, sanitize or replace all of your fabric items. When you're doing this, don't do it yourself because you're going to expose these toxins and your body's already a tremendous amount of stress. And then again, find a great holistic practitioner, whether it's me or somebody else. Find somebody that's going to come up with a plan and map that out with you, and then follow the plan. Mold is one of the three most challenging issues I deal with the practice: mold, Lyme, and cancer. These are the hardest issues to resolve fully from. It takes a lot of money, time, and energy. So if you're not willing to put in the work, please don't sign up or try to heal this process because it takes a lot of energy on your side as the client. Um, Unfortunately, with those conditions, most of the patients I talk to are highly motivated because they've got to a situation where it's almost like the roof has collapsed and I need to do what I need to do. So anything you want to share on that one?
So the only other thing that I live in Florida, and so where humidity and mold is really prevalent. So the things that we have done in our house to safeguard our house is we put UV lighting on both of our air conditionings and an air purification system on our entire house. Last thing I will say is do not give up. Mold can be hidden. So I've actually even used there are things called a mold dog out there, that a dog that is trained to find mold in your house. So if you are doing the things that Dr. Dennis says, you go on vacation, you come back, you feel sick again, listen to that and say, okay, there's got to be something here. See if there's a mold dog in your area that could come and look. So there are ways to do it, but it's challenging, just as Dr. Dennis said, but don't give up.
And once you figure out where the mold is too, and you remove it, again, sometimes you need to look and figure out, okay, what did I do that caused that in the first place, and remove that as well. So I've had people that reach out to me, and for example, it was their pillow that had the mold, and what they did is they went to bed with wet hair each night, and then they slept in the mold every day. But so they don't go to sleep with wet hair anymore. So
Wow,
but
that's a
you
good
need to
one.
identify where these things are, right? Because it could be in your mattress, it could be in your couch, it could be in your walls, it could be, I mean, it can be anywhere.
On your
So
pets.
say that again.
Your pets. If you have pets that go in and outside, they are bringing mold spores in. So washing your puppies or your kitties or your doggies is important too.
Yeah. So we'll close with this. The first step I want you to do is I want you to go to survivingmold.com and I want you to do the VCS test. This is really important. Again, if you don't think it's mold, you think it's something else, then you can just schedule a call and skip that one. But I would like you before our call to have that VCS test so you can tell me if it's positive or negative, and we can come up with a plan from there. Schedule the free 45-minute call. You must fill out the application so I have information to go over with you. And then any applicant that signs up tonight, you'll get a $400 credit towards your care, which covers some testing if you decide to move forward with a wellness program with me. And I'm done, Doc. You can just share with them kind of like any last minute encouragement or where you're at on that.
So yeah, so I mean, just in 20 seconds or less, do not give up. I was so sick. I am normally about 135 pounds. When I was at my sickest, I got down to about 98 pounds. There were points in my journey where I thought, I don't know that I can go on. Don't give up. There are people out there who are very knowledgeable and can help you. And I would say today I am 99.9% better. And if I
Amen.
can get through it, you can get through it. I promise you. So just don't give up on yourself.
Awesome. Thanks so much. Thanks everybody for showing up. And I'm excited to talk with all of you and have a wonderful day.
Yep.
Thanks,
Have a
Dr.
great
Kasey.
Friday.
Take care.
Bye.
Bye. Enjoy your weekend.